Hello there, I am Dr. Krishna Prasad, Senior Cardiac Surgeon, Medicover Hospitals. Today I want to talk about an important topic that I have been asked in recent times. As you are all aware, we are going through a pandemic of COVID which has touched our lives in one way or the other, and it is still causing a havoc all around the world. There is a threat of another wave coming at any time. During these difficult periods, I've always been asked, not only by my patients on a regular basis, but many of my relatives ask me whether they should be taking a vaccine, and particularly if they are a heart patient. I want to make one thing very clear. Every person should take vaccine as soon as possible. The reason being, as of now, there is no proven treatment for COVID. We have been trying different methods of treatment and different medicines, different antivirals, different treatment modalities for COVID, but these are all showing only partial benefits to the patients, and people who have been affected very badly are losing their lives. There is only one proven method of protecting ourselves from COVID is through vaccination. Once we take a vaccine, at least the intensity of the disease is less. This is what we have seen in the second wave, that people who had vaccination did get COVID, but the seriousness was not anywhere close to people who have not received a vaccine. So it is a very important thing to take vaccine. Now, coming to patients with heart disease, all the more important that they should be taking vaccine, because the mechanism with which the vaccine works is totally different from, and it has got nothing to do with what happens to the heart, or whatever your heart pumping is, what heart operation you had, what heart problem you have. It has got nothing to do with it. And most of the vaccines that are available in the market are very effective, and they do not have any cardiac symptoms or cardiac related side effects in them. And particularly the vaccines that are available in India at the moment are good, and we should all be encouraging patients to take the vaccine as soon as possible. Many patients ask me whether they should stop any medicines if they have been taking like aspirin, blood thinners before taking the vaccine. For some reason, these rumors are going around that they should be stopping the medicines before taking the vaccine, but those are not true. Please do not stop any medication. Continue your medicines and take the vaccine. The injection volume is only 0.5 ml, so it's a very small injection. It will not cause bleeding, or it doesn't cause any bleeding related or clotting related problems. The mechanism with which the vaccine works is it only stimulates your immunity and makes your body ready for any invasion from COVID in future. People also ask me if they are diabetic, if they have high BP, if they have a valve heart operation, or if they have poor heart function, should they be taking vaccine? Of course they should be taking vaccine. The reason why I am emphasizing about heart patients is that when a heart patient gets COVID, the possibility of that being serious is very, very high. So all the more a reason that cardiac patients, heart disease patients are a high risk group, and they should take the vaccine to protect themselves from COVID and COVID related side effects. So, and again, one of the common questions is which vaccine should they be taking? Again, I will tell you, Covishield, Covaxin, Sputnik, all the vaccines that are available in India are effective, and they are good, and they do not have any side effects. We have injected thousands of people in our hospitals and have never seen any side effects of any kind in any of the patients, both heart patients, non-heart patients, diabetics, you name it, old people, young people. So far, serious adverse effects have not been observed in any of the Indian institutes. So please take the vaccine, protect yourself, protect your family, and let us defeat COVID by taking vaccine. Thank you.